Hello, it's Dr. Hope and welcome to Mercy Grace Medical Aesthetics. Today on our Why Wednesdays, we're going to be talking about prediabetes. So what is prediabetes? Prediabetes is actually having an abnormal fasting blood sugar level of between 100 to 125 milligrams per deciliter and or having an abnormal blood glucose tolerance test, which will read between 140 to 199 milligrams per deciliters 2 hours after you take an oral glucose load of 75 grams, and or having a hemoglobin A1C of between 5.7 and 6.4%. Now, 1 in 3 adult Americans have prediabetes, and of the people who have prediabetes, 8 out of 10 do not know it. And that's because prediabetes can go undetected for years. So how does prediabetes occur? There's some risk factors that have been associated with prediabetes, including things like being overweight, being 45 years and older, having a parent or a sibling who has type 2 diabetes, having diabetes during pregnancy or giving birth to a child that weighs more than 9 pounds, or having a sedentary lifestyle, basically being physically active less than 3 times a week. Also, race and ethnicity play an important role in risk factors for prediabetes, because you can have increased risks in African Americans, Hispanic or Latino Americans, Pacific Islanders, Native Americans, also in some Asian Americans as well. So why is this important for you? Well, prediabetes is a big deal, and that's why it's important, because it can progress to diabetes for one thing, and also it increases your risk for cardiovascular disease and stroke. Actually, we found that even before progressing to being diabetic, some people with prediabetes can actually have coronary artery disease. They actually are increased risk for coronary artery disease. So things like diet and exercise, for example, losing 5 to 10% of your body weight, or exercising 150 minutes a week of like brisk walking or comparable forms of exercise, can reduce your risk for progressing to diabetes. So if you think you have risk factors for diabetes or for prediabetes rather, or if you are pre-diabetic, be sure to talk to your healthcare provider about the best plan for you, because there are different modalities such as medication in addition to diet and exercise, as well as things like bariatric surgery that can help you mitigate that risk. Okay, so remember, you matter. So until next time, I will see you at our next Why Wednesdays. Click the link so you can go to the blog for more, some more details on this. And thank you for watching. Bye.